Hello, my peeps. I am doing a retake on the RMT because the other one was difficult to hear. And I have got more people I want to send this to. And so I am going to show you about rhythmic movement therapy, which is helping with the getting attached together and working well, the cerebellum, brainstem, and the basal ganglia. And the benefit of this is sleeping better, more focus and attention. I actually can change it. It's changed a lot of kids from having nightmares. It changes their dreaming and nightmare. And it's very calming also. So kiddos that have struggles, they have meltdowns, then this will actually change that. You'll see fewer and fewer by doing this activity. I'm going to walk you through the process. It doesn't take very long. And we're going to be joined by a cat in just a moment here. Abby. Okay, so we're going to start off with, I'm going to turn this just a little bit here. And start off with the feet. And you're going to take the bottoms of the feet here, and you're just going to go back and forth, just like this. Now, all of these movements are going to be slow and rhythmic. If you go too fast, because we are working with the brain, if you go too fast, then you may end up with a kid that's really hyperactive and maybe not sleep for a while. So we definitely go slow. I'm going to put this towards her chin because I want you to see what's happening with the chin. We want a little bit of movement in the chin going up and down with this movement. This is done for 15 seconds. And if kids start off with not having chin movement, don't worry about it because they are going to be stiff possibly. But that's okay, because eventually they'll get there. Okay, bend your knees. Okay, now this particular movement has 3 ways to do. So it's going to be on top, over, and under. And I'll show you each of them, and then I usually let the kids decide what exactly they want to do. So on top is like this. Over is more of a pulling. And under is back and forth like this. Which one do you like? On top, okay? And again, slowly and smoothly, rhythmically, because that's how the brain is working, it's how it fires. And again, it's about 15 seconds. I'm not counting my seconds because I'm talking. And so we'll try to go through this so where you can follow along with what I am doing, or you can watch it and try to remember everything. I am doing this in a particular order. That doesn't mean it has to be done in this order. Okay, the next one that I do is rib cage rocking. And so I put my hands on either side of her ribs and I just rock back and forth. Relax. There you go. And it's just like this. Her arms do need to be beside her, and she needs to be a nice straight, her spine nice and straight. So rib cage rocking, we're not tickling or anything like that. It's just rocking back and forth. Okay, and the next movement, 15 seconds here. So everything's 15 seconds. Or you can do longer. The next movement is head rolling. When we're rolling the head, we are rolling it from side to side, slowly. We're not pivoting it. Now, a pivot would be I'm turning the head to the side, like this, and we're not doing that. We are rolling the head to the side. If you can understand the difference. Just rolling it from one side to the other. Okay. And now, go ahead and lay on your side, please. And she already knows what to do. You want a 90-degree angle in the hip right here. And so when I am working with kids in my office and I'm teaching parents how to do this, I put their hand on their the seat bone where they sit, and I'll place a hand here, keep nice straight spine. You don't have to do this. I don't have to do this because she's my daughter with her hand here, but it does keep her in alignment. And so you're going to just pulse right up the spine, gently, smoothly, rhythmically, 15 seconds. And you're going to want to do both sides. And so I won't do the other side on this video because you're knowing what to do for both sides. A lot of times kids want to curl up into a ball, so you want to get their spine nice and straight. And then the last one is you're going to roll on your tummy and scoot closer to me too. No.
It's for my face.
No. Scoot closer to me. And the kids are putting their hand one on top of the other hand and their forehead on their hands. There you go. Okay, and this one is called hip rocking. And so you put your hands on either side of the hips, and you're just going to rock back and forth like this. And they can either do it this way, or you can put your hand on the lower back and rock back and forth this way. Now, I suggest that when you're starting off, do the hip rocking this way, because oftentimes kids have little catches and it doesn't rock smoothly, and you're going to want it to be smoothly. And so if they have a catch on one side, you may be wanting to work more on the other side like this or like this without doing the other side if they seem to rock unevenly. And so, okay, again, this is very beneficial for kids on the autism spectrum. It's also beneficial for kids who have struggles sleeping at night, for ADHD, and it's just overall. Oh, I will share that my husband is a Marine, and this is a movement that I would do that actually brings his blood pressure down, because he has high blood pressure. And so this is something that we do, and we would take his blood pressure before and after doing this, and it would drop considerably. So that was really kind of exciting to learn that. So anyways, okay, thank you so much for watching, and I hope that you get a chance to implement this and get the benefits. All right, bye-bye.